Ischio, we already did. See, what is ischiorectal fossa? Let's understand first. See, this is sigmoid colon, right? So after sigmoid colon, we have rectum, which is straight, okay, and below the rectum we have anal canal. So on either side of the anal canal, lot of fat is there. So this fat filled area on either side of rectum and anal canal is called ischiorectal fossa. Okay, it's also called as ischioanal fossa because fat is also surrounding the anal orifice. So two names, any question can be asked, like, but the answer remains the same. So if you just look at this ischiorectal fossa from posterior aspect, it looks very much irregular, that is wedge shaped. Okay, then so now see here, this ischiorectal fossa is lined by fascia. So this is something like this white line you are finding. Here also you are finding the line. Okay, white line. Okay, so facial line space on each side of the anal canal below the pelvic diaphragm. So which is our pelvic diaphragm? See this muscle what you are finding here is actually levator ani. Levator ani. Okay, so levator ani is the muscle of pelvic diaphragm. So this is pelvic diaphragm. So below pelvic diaphragm, see here, facial lined space on each side of the anal canal, below pelvic diaphragm, whatever fat filled area is there, that is nothing but ischiorectal fossa. Now, what is the purpose of this? So, suppose when the person is passing fecal matter, stool, okay, what happens? This external anal sphincter, internal and external anal sphincters will relax, isn't it? So, when it relaxes, you will see there should be some free spaces where it can expand, isn't it? So that is possible only if on either side of anal canal fat is there. So that fat will actually let the anal orifice to open up so that fecal matter is coming out. That's it. Okay, so filled with fat to accommodate the dilatation of anal canal to facilitate defecation. Okay, now ischiorectal fossa. So this is the base beta. This is also base. This is right ischiorectal fossa. This is left ischiorectal fossa. So base is directed downwards. Now when you see the dimensions, it is the length is around 5 to 6 centimeters. Okay, anterior posteriorly if you measure it is 5 centimeters. Okay, and if you just see thickness or something like that, side to side if you check it is 2.5 centimeters. Okay, so I will show you this posterior anal canal, you will not understand. If you observe this space, it is all filled with fat, and the fat is also loose, and it should be loose only. If it is tightly arranged, if there is any infection, it can not even expand. The infections become very painful. The upper fat is very loosely arranged, but lower fat is tightly arranged. Hence, infection in the upper part are painless. At least pus can accommodate loose fat. But in the area where tight locules are there, tight arrangement of fat is there, if there is any infection, that area cannot expand, and that will lead to lot of pain. Okay, so space is filled with loose areolar tissue and large loculi of fat. So infection of the space, you will see there will be pus formation, and pain will not be so much because tension won't be there. So these are your textbook pictures which you can draw better. Only one side ischiorectal fossa is shown. That's the reason students usually do not understand what is this picture they think. Okay, this is rectum and this is anal canal. One side ischiorectal fossa is shown. You can also draw if you want one more here. Okay, now see here, this is the levator ani muscle I said. Space below levator ani is filled with fat. That is ischiorectal fossa. So this is our base. So base is nothing but skin. And if you just take it as a triangle, this area is apex. Meeting point, this muscle is obturator internus. And this green line is obturator fascia. So like the lining the obturator fascia, obturator internus, you have obturator fascia and levator anifascia. Okay, so that is the fascia of pelvic diaphragm, it is called as, they generally meet here. Okay, so this is meeting point. Apex is the meeting point of obturator fascia with the inferior fascia of pelvic diaphragm. This meeting point is apex. Okay, then now coming to see, this is another view. This is the perineal body picture which I kept when we were doing perineum, 10 muscles interlacing point, meeting point. So that view, perineum view, this is. So here, this is a anal canal. On either side of anal canal, lot of fat is there, nothing but ischiorectal fossa. So this becomes anterior boundary. So it is nothing but this green membrane is perineal membrane. So posterior border of perineal membrane forms anterior border of ischiorectal fossa. This is ischiorectal fossa, its anterior boundary. Then this is posterior boundary of our fossa. How is it formed? If you learn this picture, you will write in your own words. What is this? Sacrotuberous ligament. One is enough. Posteriorly, sacrotuberous ligament. Then this is our lateral wall beta. So what muscle do we have? Obturator internus and we have obturator fascia. Okay, then this is our medial wall. So this medial wall, how is it formed? So you are finding sphincter muscle, which we studied when we were doing anal canal. What is the sphincter? External anal sphincter muscle is forming the medial wall. Just look at the picture, you will write in your own words, practice the diagram. You need not write multiple points, 1 or 2 points, and good diagram is also enough. Okay, now once you do the boundaries of the fossa, then what we will do is we will see the like recesses. What do you mean by recess? Recess means this fossa's extensions are called as recesses. If it is extending anteriorly, you call it as anterior recess. If it is extending posteriorly, you call it as posterior recess. Connecting right and left from behind, like this. This is our anal canal, right and left side. If they are connecting from behind, you call it as horseshoe recess. Horseshoe recess. Just name them, don't give the description. Now, contents of ischiorectal fossa is important and easy also, beta. Don't read anything, practice this picture. Anyhow, we need to draw ischiorectal fossa, right? So, a lot of fat is there. First thing you will write fat, then you will see these vessels, posterior labial vessels and nerves, inferior rectal vessels and nerves, perineal branch of S4 nerve. Okay, like that. So if there is any infection in this area, you call it as ischiorectal abscess. Okay, pus is formed. So that is ischiorectal abscess. If it is both right and left ischiorectal fossae are involved, then you call it as horseshoe abscess. If there is any abnormal communication between anal canal and rectum, you call it as anorectal fistula. Anorectal fistula. Okay, that is fistula in ano. That means there is an abnormal communication existing between the anal orifice and the rectum. Okay, rectal prolapse, if rectum comes out. So there is one important, sometimes this comes as a 3 marks question. This is our ischio, don't read anything, you just look at this picture. This is our ischiorectal fossa. And we know this is the lateral boundary. On the lateral boundary, on the corner of the lateral boundary, there is one canal called as Pudendal Canal, which is also called as Alcock's Canal. Okay, so it's a facial canal which is situated on the lateral wall of the ischiorectal fossa. Okay, so it is formed by splitting of this obturator fascia. What is it containing? Pudendal canal, pudendal vessels and nerves. Like that you remember. It becomes easy. Okay, pudendal nerve and pudendal vessels. Don't go into much detail. You will get confused. I don't want to confuse you. See, pudendal nerve is there, no? So during the process of delivery, generally this pudendal nerve is blocked by giving the local anesthetic drug like lignocaine, xylocaine. If this nerve is blocked, the lady will not feel the pain during the process of labor. Okay, that is all about ischiorectal fossa beta. So let me take you to the other answers. Till then, you keep studying.